Dr. Thomas Hedberg with the International Medical Crisis Response Alliance, or IMCRA, and today I'd like to speak with you about some of the myths and superstitions surrounding the coronavirus pandemic, which are current in some areas of the world. The information we're providing here is derived from the most recent U.S. Center for Disease Control analyses and the latest epidemiologic and virologic research. Please feel free to direct anyone toward this website and video module at any time. This video module presentation and its contents are the property of IMCRA and are protected by international copyright law. So number one of the most persistent myths that has evolved over the past few weeks is that warm weather will kill the virus, and that when springtime comes to the northern hemisphere, the threat will diminish. This is wrong. Despite the incorrect statement by Trump that the heat, generally speaking, kills this kind of virus, there's currently no evidence that warm weather, taking hot baths, or drinking hot fluids will make you immune to the virus or will somehow flush it out of your system. In fact, there is no evidence that proper hydration will do anything other than help you maintain optimum physiologic health prior to any exposure to the virus. Outbreaks in both Singapore and Australia, which is currently in the midst of its summer months, suggest that warm weather will do little to stop the spread of contagion. Number two, from China has come the myth that, quote, if you take a deep breath and hold it for more than 10 seconds without coughing, discomfort, stiffness, or tightness, it proves there is no fibrosis in your lungs, basically indicating no infection. This is wrong. While a positive result from this test may indeed indicate infection, a negative result does not indicate a lack of infection. As we have noted previously, there are many cases of confirmed coronavirus infection that are either very mild or almost completely asymptomatic. The danger in assuming non-infection from a bogus test like this is that you or another person may still be a source of disease transmission to others, regardless of whether or not any obvious infection has been recognized or diagnosed. Number three, as far as we know, this next myth originated in England. It states that even if the virus enters your mouth, drinking water or other fluids will somehow rinse through your throat and stomach. And then once there, your stomach acid will kill all the viruses. Therefore, drinking warm water or hot water is effective for all viruses. And then they say try not to drink ice water. This is wrong. This is pure nonsense. The novel beta coronavirus will enter the mucosa rapidly. You are not going to rinse them away with warm or cold water, and stomach acid is not going to kill all the virus particles. Number four, in terms of home treatments, which there are quite a few being recommended, there have been some very determined assertions circulating on the net that eating garlic, sipping water every 15 minutes, taking vitamin C, etc., will protect a person from the new coronavirus. Further, some of the more dangerous home remedies circulating on social media include the consumption of essential oils, colloidal silver, and steroids. And some posts have suggested that putting sesame oil on the body or spraying yourself with alcohol or chlorine will somehow protect you. This is wrong, and this is dangerous misinformation. There is currently no scientific or medical evidence that doing any of these things will prevent a person from contracting the virus. More importantly, inappropriate contact with these substances is harmful and can be poisonous if used improperly. Number five, there has been an assertion that if the coronavirus falls on a metal surface, it will live for at least 12 hours, and that after that, you are okay. This is wrong. The correct figure is actually up to 72 hours on any hard surface, not just metal. While viral particles landing on some substances, such as copper, will survive only 4 hours or so, and survival times will vary with environmental conditions. For example, surfaces receiving high UVA irradiation from sunlight will be less hospitable to viruses. The best move overall is to avoid touching common use surfaces. As we've stated before, these will include door handles, banisters, handrails, elevator buttons, cash and change, public touchscreens, and components of public restroom facilities. Number 6, and again from China, the statement that if someone sneezes, it takes about 10 feet and then it falls to the ground and it's no longer in the air, so you are safe. This is wrong, and this is another dangerous falsehood. While maintaining a safe distance and practicing as much isolation as possible is always a good idea, thinking that there is no danger of contracting the virus if someone sneezes or coughs 10 feet away is not a good idea, because virus particles can remain airborne in aerosol droplets for several minutes, and a person can simply walk into a current of air that is carrying them. Number 7, there is a myth from Northern Europe that the virus, quote, hates the sun, unquote. Wrong. Well, of course, a virus is incapable of hating anything. There's currently no evidence that sunlight on your skin will do anything other than help increase your vitamin D levels. Infections in sunny countries like Iran are sky high, while UVA wavelengths from sustained, intense sunlight on hard surfaces will have a sterilizing effect on viral deposition. Exposing your skin to sunlight is not going to make much difference. Chemical disinfectants, such as bleach, 75% ethanol, peracetic acid, and chloroform, will indeed kill the virus on hard surfaces. However, again, if the virus is already in your body, putting those substances on your skin or under your nose will have no effect and will be dangerous to your health. Number 8. This is a rather odd myth that has arisen lately, and it's that black people don't get coronavirus. This is wrong. Essentially, anyone of any phenotype or genotype can get the coronavirus. Black people are as susceptible to the virus as are any other racial grouping. No one should assume that an African ancestry will make them immune or incapable of spreading the virus. In fact, at least 10 African nations have already reported nearly 100 coronavirus cases to date. Number 9. A rather dangerous myth is that children cannot contract the coronavirus, so the same precautions adults are taking need not be practiced with kids attending school or engaged in other public activities. This is wrong. Anyone of any age can contract COVID-19. Further, some children can get very ill from the disease if contracted and not properly treated. While the active infection rate in children under the age of 12 seems to be less than in the general population, the reason for this is still unclear and may be a consequence of statistical irregularities. As regards age-relatedness, the elderly are at considerably greater risk of contracting severe cases of COVID-19, and people with pre-existing medical conditions are the most vulnerable and should particularly be isolated from potential contact with anyone infected with the virus. Number 10. Contracting COVID-19 is a death sentence. This is wrong, and this is a good example of where fact needs to be separated from fiction. The mortality rate for COVID-19 worldwide currently stands at between 3 to 4%. Now, this includes the very elderly and those who were ill beforehand. A review of the current epidemiology shows that most cases, in fact, will resolve with relatively mild symptoms. The greatest danger is non-containment. And as noted earlier, the greater the number of infections, the greater the chance for viral mutation into a more dangerous form. While still more serious than seasonal influenza, COVID-19 does not compare at all with the influenza pandemic of 1918. Our mission here at IMCRA is to make certain that this global disease is contained and eventually overcome before anything like that can happen again. Now, as a final note, the best guideline for determining whether you have coronavirus infection or a cold or simply a seasonal flu is shown here. Whereas the flu and coronavirus share some symptoms in common, the likelihood of a COVID-19 infection is increased if you are experiencing a shortness of breath in addition to flu-like symptoms, as well as having a history of travel and confirmed exposure. In summary, the best treatment for coronavirus is not to contract it in the first place. In our previous module, we went through the various techniques that you can use to avoid contact and avoid infection. These include washing hands frequently, not touching common use surfaces, or basically isolating yourself from large groups of people, some of whom may carry the virus. I want to thank you for joining us again. For further information and updates, please visit us at www.imcra.net or Google us at IMCRA and globalgiving.org. Thanks for your attention, and once again, good health.